Hello students, today we are going to see about health assessment, which is also known as physical examination. Have you heard about health assessment? It is one of the major steps in the nursing process, as assessment is the first step in the nursing process. Being a first year nursing student, you must know what is health assessment, how it is to be taken when the patient is coming to the hospital. Unless until you don't do health assessment, we cannot give proper or adequate quality patient care. So I am taking you to next slide about its definition. So how we can define health assessment? The first definition, it is a systematic collection of objective information that is directly observed or is elicited through physical examination technique. So let us see the basic terminologies here. The first one is systematic collection. So what do you mean by systematic collection? Systematic collection means sequence wise. There are proper steps. Based on that steps, we have to take an assessment of the patient. Then coming to objective information. What do you mean by objective information? Before going to objective information, you must know about subjective information as well. So, subjective information, also we can call it as subjective data, which is the first thing when the patient comes to the hospital or else when they are admitted, they may share with you, they may express their feelings, which is known as subjective data. So, ultimately it is patient based, or we can say it as a person based. Another one is objective data. Objective data were the nurse or the doctor or any healthy member going to observe. Here we are going to write about observation. So for the more clarity, let me take you to one example that is a common example everyone knows, that's about pain. Patient is telling, I am getting pain, or else if it's a surgical case, maybe any post-operative case like lumbar disc rupture, he might have undergone any surgery. So after the surgery, he may have pain. So he will tell, I am getting hurt too much. My pain is hurting too much. It is very worst. So this is subjective information. I cannot understand any person's or any patient's pain. Only patient or that particular person only can express their feelings. So that is subjective data. And what about objective data? Here we are confirming with a person through this technique, through this physical examination or health assessment technique, that whether his pain is like hurting him too much, how much pain he is having, what is his facial expression, whether his pain is affecting his normal activity. So those things are known as objective data. So here the nurse will assess the pain, nurse will observe the patient's pain and confirming about the patient's pain. So that is objective information. Here we are going to observe or we are going to elicit it through examination techniques. Examination techniques are there in the further slides. There are various techniques. Through the technique only we can do health assessment. Another example, it is the head to toe review. Head to toe, from the head till your toe. So we have to review the person about each system. You might have learned in your anatomy about various systems of your body, like nervous system, integumentary system, cardiovascular system, muscular system, genitourinary system, gastrointestinal system, respiratory system, so on. So based on those system-wise assessment, we are getting a review of the patients. What is their normal remarks, and if there is any abnormal, that also we have to be noted. Next is why we do physical examination. That is the purpose. The first purpose is to understand person's physical and mental well-being. So mental well-being is also very important, right? Because physically as well as mentally is to be taken care. You know, in the health definition, you might have learned WHO definition is very common. World Health Organization has defined health is a state of complete physical, mental, social, emotional, spiritual, sexual health. Everything is coming in that, right? So, and not in the absence of any disease or any infirmity. So, mental part also we take care as well as physical. But in this health assessment chapter, we are mainly going to see about the physical aspect of the person, because mental aspect will be seen mainly in mental status examination, which you will learn in your psychiatric nursing, which is in your 3rd year. So let us focus mainly on physical assessment. Another purpose is to detect any disease at its earliest stage. For example, if a patient is coming with a cancer, so we don't know whether the person is having cancer or not. He might have said like, I am having lump in my neck, maybe like in neck region, he may have a small lump, mass formation will be there. So you have to just touch here, we have to just palpate here, and if we feel like any mass formation is there, ask the person whether they are having any pain. So this is like a primitive step towards further investigation, because we cannot confirm it is cancer, it is any lymphoma. It is known as lymphoma, that is lymph node gets like any like cancerous stage. So I'm just giving only example. So to detect such disease, we are taking care of health assessment. Another one is to identify the cause and extent of the disease. How much costs, like what it costs. For example, if the person is telling, I am having chest pain, I am having pain on my chest, I am having pain on my left arm. So we have to confirm whether it is any heart disease. So what is his cause? Why he is getting pain? Whether he having any history of previous disease, any history of hypertension, whether his blood pressure is increased or not, whether he has having any bad habit of any like lifestyle like smoking, alcohol, or maybe he's having habit of consuming fat foods, fried foods, that may also cause some problems in his cardiac system, maybe like heart disease. So through the proper assessment, we can find that. Another one is to understand the patient's condition of his disease. Like for example, if the same case, if you are taking like a heart patient, like a cardiac case, maybe myocardial infarction or any blockage in the heart. You might have heard about this because it's very common syndromes like a blockage in the heart, right? So if such patient gets admitted and if you have started the treatment also, daily we have to see whether they have improved or any changes in their condition, or whether there is any problem or is not getting setting with that particular treatment. So for those things, basic health assessment is mandatory. Next is to determine the nature of treatment or nursing care needed for the client. Again, the same example I am taking. If the person is cardiac case, right? He is having heart block. He is getting treatment. He is getting any surgical intervention. For example, he had undergone any bypass surgery. Have you heard about bypass surgery? Of course, you might have heard in a simple way, but it's like a complicated surgery, heart surgery, open heart surgery. So if that person has underwent any such surgery and after that post-operation time, post-operative day, we call it as post-operative day, the patient is admitted and maybe today is his first post-operative day. Post-operative means after the surgery. So you are assessing the person whether he is having any pain, whether there is any risk for any infection, especially chest infections, whether he is getting any breathing issues or any cough or any such problems we can understand, and based on that we can plan our treatment. So that understanding means we are assessing, we are seeing heart assessment especially. And the second last point is to contribute to the medical and nursing research, because research is the major thing these days. Have you heard about research? Nursing also have very good contribution in research. Nursing research is one of the major subject in your BSc Nursing syllabus, but not in first year. You may learn in your 4th year. So when you do research, you will identify exactly the problem of the person, what exactly we can contribute to the health, right? So in the medical or nursing research also, it will give a assessment. For example, if I am assessing patient's heart, I am taking the same example because for more clarity, right? So if I found any abnormality, any heart murmur sound, have you heard about murmur sound? Murmur sound means something which is abnormal sounds, not normal sounds of the heart. So that time what happened, patient may say, patient may feel some difficulty on when you put stethoscope and you going to auscultate the patient, you may hear that abnormal heart sound. So maybe that could contribute something to new to the research, maybe some new sound if you found, or if you find that patient's dietary habit is getting hampered because of his diet, he is having problem with his cholesterol, and because of excess cholesterol he is having this cardiac disease. So that can be another cause why the person is getting such cause, right? So research will also contribute in the health assessment. And last is to understand whether the person is medically fit or the person is having any particular disorder based on that particular task. For example, if I want to go for any interview, so being the rules of that particular interviewer, they may tell you should be medically fit. You should provide a certificate, medical fitness certificate. The same way I will go to the doctor, I will see my health assessment checkup, complete body checkup will be done, and the doctor will file it as a medically fit. This client is medically fit and you can admit the person for your job. The same way when the person is coming, when a patient is coming in your hospital, they may also have to get assessed properly to ensure that they are medically fit. So these are the major purpose. Let me take you techniques to or the skills of physical examination. So I told you in your definition, have you remembering definition? What was our definition? The systematic collection of objective information which is directly observed or elicited through examination techniques. So these techniques are: number 1, inspection, second is palpation, third is percussion, then auscultation, and last is olfaction. So I'll give you a brief explanation about each technique because you should be very much competent enough to do this examination. Number 1 is about inspection. This is the first technique. Inspection. Have you heard about this word inspection? Generally we speak, people come for inspection. For example, in your college, you might have heard some inspectors are coming to visit the college. Inspectors means not police inspectors, that is from the nursing council who has given the authority to this college. So they have the power to ensure whether the college is running based on the guidelines given. So that is inspection. Inspection means we are going to inspect. The symbol word meaning is inspection, means like we can say it is like simply we are going to observe through our eyes, through our vision. So vision is very important here because you are going to ask something, you are going to observe something. So what all things you are going to observe? So here I told you always we have to do visual, always. That is like a term used because we have to continuously see the person. I am not going to ask if the person is telling I am having pain. So we have to just observe. Sometimes when we are observing the opposite person, we can get many things. Eyes can speak a lot. Have you I think you have heard in psychology also, because when we can speak through your eyes also, because they have all that power to understand the feelings. We can observe the color of what? Maybe patient's color of hair, whether hair is black in color or any dullness in there. His skin color in the face, whether the face is dull or not, whether his skin we can see, whether there is any color changes, any irritation because of some allergic problem. Sometimes the skin gets redness, right? Then the shape of the client, shape in the sense like a chest shape, we can see whether this is a barreled shape, it is in maintained shape. The size, whether the size of the any particular, maybe the like any lump, any mass formation is there. In the first slide I have given one example, like if this area where they're having lump formation, so you can see the size of that particular area, or maybe you can see about a patient's overall expressions also. Symmetry means similarity, whether there is any paired organs. For example, like if I'm having two arms, two legs, right? It's a paired organ. So both are in same position, both are in same structure, same size, or whether there is any abnormality in one particular hand or in one particular leg, that is symmetry, similarity. Then position and movements. Movements also we can understand the person, whether there is having any abnormal movement of their body, whether they are not able to move. Sometimes patient is on bed, they are bedridden, they are unconscious, right? So they cannot move. So we can see what is the issue. Or their position, they are not able to maintain the upright posture. Upright posture means while sitting they have to maintain like a sitting position, or like sometimes the person may do like a stooping position, like in Hindi we told as a jukna, like stooping posture. So these things we can see whether they are having any issue. So based on the initial contact with the person, we are going with this like inspection. So there are some principles, everywhere there are some principles to be followed. So for the inspection also we have like adequate light should be there, very important principle, because you must have in your tray, when you prepare that tray, so in the article you should have like a pen light or torch to see. For example, if I want to see the pupil, eyes का जो pupil है, so that मुझे देखना है, so I have to see whether the pupil is dilating or constricted. Then only we have to expose the body parts, also all the surface can be viewed. Very, very important, because here we are going to see head to toe. So it is very important thing. We cannot forget patient safety. Their privacy is very important, because we cannot expose the person completely. We cannot say the person to open their dress and to assess. So proper privacy should be given. Only the required parts to be exposed. For example, if I want to see the chest assessment, so that I have to only open the chest region or the front part of this shirt, whatever the person has wore, so that only I have to remove, not all body dresses, right? So it is very important. We have to take care of the patient's safety as well as privacy. Then another principle is compare each area inspected with the same area on the opposite side of the body. Like as I gave one example about the symmetry, because many of the body parts are paired organs. For example, eyes. So if I check one eye, then I have to check another eye also, because maybe person is having only problem with right eye. They are telling right eye is having pain, but we have to confirm about the left eye also. So in the inspection itself we have to see, as well as in the whole other steps also we have to follow this principle and pay attention to the detail. Do not hurry inspection. At a glance we can observe the person, no doubt, but we have to be very slowly, because it's a tedious process, it's a cumbersome process. So we have to see very detailed manner about the person's body examination. Got it? So this is about first technique, that is inspection. So next is about palpation, number 2. Okay, we are discussing about techniques. The first technique was inspection. So next technique is about palpation. Have you heard about palpation? Palpate. Palpate word means we are using our hand. Okay, so I'll just write here how we can define this word like a palpation. Palpation means we are using our hand. With our hand we are going to do the assessment. In inspection what we are doing, we are only going to observe through our eyes. We are not going to speak more, we are not going to touch more in inspection. But in palpation, here the touch comes. So sensitive assessment, we are using the hand to touch the body part. Here sense of touch we are using. So palpation of what? Mainly we are going to do the palpation of skin, not only skin, many areas we will go for palpation. So skin, for example, like temperature, have to see. Generally people do know, like if I am getting like more high temperature, so I will just touch here, I will touch here. So that itself is a palpation, touching and seeing moisture, skin moisture, like skin we are touching and we can see whether it is moist or not. Texture, turgor, I'll give more examples in these terms, don't worry, because in the further slides it is there. Tenderness, I'll just write here because this term I'm going to repeat many area. Tenderness means pain on touch. Do remember this term, pain on touch. If I touch one particular region and person is telling I am getting pain, that shows it is tenderness. So pain is subjective and tenderness will be objective. What is subjective? Subjective means person is telling. Objective means I am going to observe. I means as you all nursing students or nurse going to observe and finalizing. So any tenderness is there, thickness of the skin we can see. And the dorsum surface, dorsum means back part of the surface. This part of the surface is known as dorsum, okay, and this part is known as palmar. So dorsum is back surface and palmar is the front surface. So dorsum surface of hand and fingers are used to measure the temperature. So dorsum we are going to, like this part we are going to assess the temperature. Like this I can see whether there is any temperature change. And the palmar surface, this part of the surface, palm area, right? This surface or the finger pad, this we are going to assess the texture, like a consistency and the pulsation. You know how to check the pulsation with your 3 fingers, then the middle finger we are keeping like here in the procedure you might have learned. So here we are keeping our hand and finalizing the pulsation. This procedure, like doing this pulsation itself, is palpation. So we are using our finger pads and this is palmar surface. A nurse's hand should be very warm and fingernails should be short. Very, very important, because sometimes we see people don't cut their nails. So being a nurse, we have to be very professional. We should not give any infection to the person. So we have to take care of that part. We have our hands should be warm. We can provide like this. Our arm can be rubbed like this and it will be like a, you may feel warmness, right? You can just touch, you may feel warm. So that is, otherwise sometimes what happens, our hand is very, sometimes gets very hot or sometimes very much cold. So patient may feel like very cold, okay? So better go for warming, and fingernails should be cut properly, then only you're going to assess. Otherwise it will get hurt to the person and you have to be very gentle. Our touch should be therapeutic touch. Therapeutic matlab treatment touch hota hai. So we have to see my touch is proper or not. So gently I have to touch, very respectfully. And one more thing I would like to notice to hear this thing, that without person's consent we cannot touch the person. So you have to just tell the person, I am going to assess, I am going to touch you because I want to go for health assessment. So I'll just give you 2 examples of the palpation. One is light palpation. Light palpation means you can see that image, okay? This is a patient, right? And you see how the body parts is exposed, because that person is going to assess about the abdominal region, right? ये जो part assess करे, so that is abdominal part, and you have to place the hand on the part you will examine. So this particular area that person is going to palpate. So in the procedure you may learn how to palpate. In the theory class I cannot show you completely about that palpation part, but still I can tell you how to palpate. For example, this finger I am keeping, so I'll just keep on my abdomen and I have to go for lightly, like about 1 centimeter or ½ inch. You may have doubt how to understand the 1 centimeter. We are not going to measure like whether I am going to depress. Depress in the sense you have to go into press little bit, not very deep. Lightly you have to just press. So you also may get understand it is very light. And when you are touching or when you are palpating here, generally we have to do, and when the person will tell that I am having little pain, or they may tell no, I am very comfortable, I do not have any problem. Then deep palpation, that is a Second palpation, deep. Deep palpation, you see both hands are used. Any condition of the organs in the abdomen, that particular area, you see both difference, you know? Like light palpation, deep palpation, very difference are there. Like deep palpation is for 4 centimeter. You have to be depressed too much. You have to deeply with both hands. You can just press and go very deeply inside and can feel. For example, sometimes in the liver. So in the liver part, we are going to see in the right side. So here we can go for sometimes light palpation, sometimes deep palpation also we can go for, like whether hepatomegaly is there. Hepatomegaly, that means enlargement of liver. Liver size will increased. Otherwise, liver will not be palpable. Liver we cannot feel. But if there is any abnormal liver, fatty liver, the liver gets more fat, patient is very alcoholic, they get cirrhosis of liver. That is one of the disorder of liver. So as you touch or go for deep, as well as even the light palpation also you can get, that patient is having pain. So this is about palpation. Next technique is percussion. So first we have seen inspection, then we have seen palpation, and I told you palpation are of 2 types. One is light palpation and another one is deep palpation. Next we will see about percussion. Percussion means simply tapping with the fingers, tapping like this, tapping with the fingers. So I'll just give an example, like we are tapping the fingers to understand the condition of the internal organs, right? Because some particular organs, because of that resonance, some vibrations may heard. As soon as you tap, you have to just tap like this, not this part, okay? I'm just giving example which is exposed right now. So when you tap, what will happen? You know, some sounds will produce, and based on that sounds, you can understand whether it is normal sound or any abnormal sound. So it is the act of striking one object against another to produce vibration, because it will give a vibration and that vibration will travel through the body tissues. Character of sound also will be heard depend upon the density of the underlying tissues. So how much dense the tissue is, based on that the sound will appear. If any abnormal sound comes, it indicates maybe like mass. Mass means the group, like the collection of fluid, like I said about the cancer, lymph node, lymphoma, Hodgkin's lymphoma. So as you touch here, then you may feel that lump mass here. Even you can like do the percussion also, whether there is any air or fluid in an organ or the body cavity. Like for example, abdomen. So sometimes abdomen gets distended, it will come like fula hua पेट बोलता है ना, like it comes like more. So it is maybe filled with fluid or air. So you can just do the tapping. As you do the tapping with the finger, you can understand whether there is any normality sound or at least abnormal sound. So methods, I am going to give an idea about the methods. You can see in the diagram also how we go for the methods of percussion. We have to hyperextend the middle finger. Middle finger is this finger, okay? This middle finger we have to hyperextend. We have to do little bit extend. You know what is flexion and extension? That also you might have learned in your anatomy. Flexion. Flexion means towards your, like when you take your elbow. So if I am doing like this, taking my hand towards me, this is flexion. Extension means taking out like this. So this is flexion, this is extension. Flexion, extension. So for everything, for fingers, flexion, extension, flexion, extension. So for hand, like legs, everywhere we can do. So here we are going to do the hyper extension. More extension we'll do with the finger, pleximeter finger. Finger is, this middle finger is known as pleximeter. You know the name of this finger. This is thumb. This is index finger, middle finger, pleximeter, that is in the bone part, then the ring finger and the little finger, right? So these fingers, in that middle finger mainly we use of non-dominant hand. Non-dominant hand means the hand which is not in regular use. For example, I am a right hand person. You have seen, right? I am writing with right hand. So my dominant hand is right. So I should take non-dominant hand. My non-dominant hand will be left because I don't use left hand more, right? So this hand I will use for the method of this percussion. So I will give this middle finger of this hand, I will press its distal phalanx and the joint firmly on the surface to be percussed. So you can see in the diagram, I'll just zoom here, so you can see very clearly, like in the bone. I'm not going to take anatomy class, but just for your understanding purpose, in this particular area is known as phalanges, right? So in the phalanges, you can see this bone is known as distal phalanges. This is medial. Medial means middle phalange, and this is proximal. Distal means distant. It's not near. Proximal is near to you. So this both distal and middle and proximal, these phalanges we are going to use, right? So that distal phalanges we are using, so that distal phalange you have to press. So this is my non-dominant hand. I am taking my middle finger pleximeter and the distal part. You can see here 3 divisions. You can see the lining, right? So this 2 linings are there, no? So one lining above that lining is distal, medial, and below that is medial, proximal. So this distal part I'll just press. Okay, I have to jointly press on that area. I have to hyperextend. I have to just hyperextend. I have to just join. For example, in the hand, if I'm just jointly press, and the distal phalanx should be touch the surface. Having other part of the surface, what will happen? It will damp the vibrations. If other fingers or any other part gets touched, what will happen? The vibrations will not be heard clearly. Second step, we have to place position the forearm of the dominant hand close to the surface with the hand cocked upward. So you have to just cock upward. So here I have kept this hand. I just keep this hand. This is my non-dominant hand, and my dominant hand is this. So this dominant hand forearm I have to take, and hand should be cocked up, and the middle finger partially flexed, relaxed, and poised. So this is flexed. Okay. So with the middle finger, I have to place the list. So one finger is like this, and another finger is like this. You have to see the diagram like this. You have to poise to strike. And the third step is we have to just quickly and sharply with the relaxed wrist motion, we have to strike the pleximeter finger with the tip of the right flexor finger of the dominant hand. So this is my dominant hand. I am keeping like this. I am going to tap like this. Okay, I'll keep like this. Like simply I'll expand and I will do the tapping. So for example, if I do like this, I have to tap above that finger, not directly on the person. Some area we can do, but most of the body parts we have to use both hand, non-dominant as well as dominant. So non-dominant hand to place that finger and dominant hand to tap that above part of that finger. Then after that you have to withdraw the finger to avoid damping the vibration and strike 1 or 2 blows. Don't do more times because it may disturb the person, and the person also may feel very awkward, embarrassing moment, right? So you have to just do 1 or 2 blows. So there are various types of sounds. So you may have thinking, what will be the sounds which coming when you tap? Simply we are tapping, you just see whether you are getting any sound, you just hear. So normal sound is known as resonance. It's known as resonance. Another sound which is like a tympanic sound, that is sound heard over air filled structure. Like my abdomen, if it is very much extended, so I will tapping like this. If I will do like tapping like this, so some air filled structure sound comes, no? That is known as tympanic sound. Another sound is hyper resonant. This is like a puffed up cheeks. Cheeks have to be like this, no? Puffed. So when you are puffing up and like a lung tissues, mainly for the lungs, like chest region, if you go for percussion, so like a puffed up cheek sounds will come, and that sound is known as hyper inflated sound. Next is normal resonant sound. So normal resonant sound means sound produced by percussing a normal chest. Normal chest sound is known as normal resonant. Then is dull sound, which is like a liver. If the liver is enlarged, what I told you about enlargement of liver? Hepatomegaly. I'll just write for your further understanding. Hepatomegaly. Megaly means enlargement. Hepato means liver. There are many types of enlargement like spleen. अगर spleen का भी enlargement होता है, so this is known as splenomegaly. So like that, okay. So that's about percussion. Next is auscultation. Have you heard about this? Have you experienced about auscultation? Of course, yes. Once in a time, you might have visited any doctor. I don't think so. The person has not yet visited any doctor till today. So auscultation they always do with the stethoscope. So you know stethoscope parts, right? So that also I'm not going to give you in a very in a brief way. I just give you how the stethoscope we can this part is known as earpiece, which are going to keep on the ear. This is binaurals. Then this is tubings. Then this complete diagram is known as chest piece, which are going to keep. So this is bell. This small part is bell, because for hearing any less sound or sharp sound we are not using. I mean, for the less sounds we can use bell. For pediatric case, for the child also we can use this small part, right? And this biggest area, this big part generally we are using, and that part is known as diaphragm. Okay, so this is just for your understanding stethoscope parts, which is not in the syllabus. So we are going to listen the sound of the person's body, like especially heart sounds or any breathing sounds we can hear very clearly. One sound we can hear only through percussion, that is normal vibrations. Other than how the heart is working, whether the circulation is proper or not, whether the valves are opening or closed adequately. So for that purpose we are going for auscultation. Even for breath sounds also we can see. So stethoscope I told you, heart and blood vessels I told you about the circulation, lungs also I told you about breath sounds. Even for the gastrointestinal content, bowel sounds, like after eating food also you can see the movement of your abdomen, right? Any peristalsis movement, that is known as peristalsis, normal movement of your abdomen, right? So what all things, when you are assessing the auscultation, you can hear various sounds like a pitch ranging from high to low, okay, high sound or low sound, whether it is soft or loud, whether the sound is like a blowing sound when you are blowing the balloon. Okay, so when you blowing the balloon, that is blowing, right? Or bubbling sound, maybe sound like water running out of bottle. When you are throwing away the water from the bottle, you are you do suppose this is bottle and you do like this, and we just keep up down. So what will happen? That water is coming out. That sound. This is just example, okay? Then the duration, like a short, medium or long duration. How much time this sound is coming, whether it is regularly coming or long sound, or it is medium or not. So this is auscultation. And last one is olfaction. Olfaction, have you heard about olfaction? Olfaction is olfactory nerves. In the nerves also you might have heard. So this is about smell with our nose. One was about this is fifth step, that is the last step, like with our eyes, that is for inspection. Then smell with our nose. So what you are going to smell, it is not possible to smell everything, but in some cases patients' body odors in the sense whether they are having any abnormal odor, bad breath, Because if I am going to take patient's vital signs, temperature if I am going to assess, if I am going for any mouth care, so sometimes I may get bad smell which is not normally should happen. Not like they are not brushed their teeth, not that sound. Sometimes the person is having oral cancer. Have you heard about oral cancer? Cancer of the mouth, maybe because of their bad habit of tobacco consumption or cigarette smoking, sometimes like eating more gutkhas and all, no, so they get cancer in their mouth oral cavity. And once they get cancer, so afterwards what will happen, they may get fibrosis, the fibers gets get accumulated, and they may not be able to open the mouth properly. Pus formation will come, more infection will become, they are not able to clean their mouth even. So what will happen, bad smell comes from their mouth because of that particular cancer. So there is no need to ask anything to patient. By smelling itself, by doing adequate olfaction itself, we can understand the person is having some issue with the oral cavity, that may be the cancer. So even sometimes that is a body odor, sometimes fluid odor or drainage from the wound. If I am having a chest wound, chest drainage, some surgery might have gone, so or something thoracocentesis procedure have gone, or anything, something related to chest, so drainage tube will be there, one tube will be connecting from the chest, so that tubes will have that drainage, the fluid will come out. Sometimes that fluid also smells very bad, like not a normal smell. Maybe some wound, if the person is having more pus, so that pus when it comes out, no, that pus smell also we can smelt it. So that is olfaction. So totally we have seen 5 assessment. Number 1 is inspection. Number 2 is about palpation, where we are going to touch the patient and we are going to go for deep and light palpation. And number 3 is about the percussion. We are going to tap with the fingers and see the sounds of the particular body parts. And the number fourth is auscultation. We are going to be using the stethoscope and we can identify about the heart circulation, blood circulation is proper or not, whether the lung sounds, breath sounds are there or not. And the last is olfaction. With the help of smell, we can identify person's abnormal smells. So these are total 5 techniques or skills required in the head to toe examination. Head to toe examination is also known as health assessment, also known as physical examination.